The government is stepping up measures to ensure the continued care for people living with non-communicable diseases. A multi-million-dollar pilot program was recently signed with 4 private health facilities to provide primary care to non-COVID-19 clients with diabetes and hypertension. Simone Absalom reports.
Health and Wellness Minister Dr. Christopher Tufton says the program will help public health centers to focus on critical cases and the pandemic response.
The significant demand that the pandemic response has placed on the resource of our health services has meant that other types of diseases, and particular non-communicable diseases and other ailments, have not received the attention that they require in terms of treatment and care. So in this pilot, some 5,000 patients who are on the register of the health centers will benefit from this partnership. Of those, approximately 50% of patients have their conditions controlled. Potentially, 1,000 beneficiaries can be added to the program as we identify more private providers. So we're starting with the 4 persons who are here, or 4 entities, but the intention, given the progress of the program, would be to expand over time.
Dr. Tufton says the program will see local health centers identify eligible members of the NCD's community and refer them to the participating private practitioner to continue their care.
The public-private partnership for the provision of services within the 2 areas will pilot initially in 8 health centers and 4 private practices in Clarendon, St. Anne, and 2 in Kingston and St. Andrew. Patients on the diabetes and hypertension registers within these facilities will be selected based on a predefined inclusion criteria and will be referred out for treatment and care to the private doctors. The local health center will identify the eligible members of the community and refer them to the private practitioner to continue their care. The health center, of course, will ensure that communication is maintained with the private practitioner and the necessary protocols in place for patients to be referred back to the public health system if the need arises.
The health minister explains that persons living with NCDs have a higher risk of critical illness as a result of COVID-19. For example, persons living with diabetes.
People with diabetes, for example, are up to 3 times more likely, according to what I'm told by the experts, to have severe symptoms or die from COVID-19, 3 times. Hypertension, cardiovascular disease increase the odds for severe COVID-19 by 2.3, 2.9, and 3.9 times respectively. In other words, the chances of your dying having hypertension or cardiovascular disease are significantly increased if you get the COVID virus.
The Health Ministry has assured that patients will still be able to access services from the National Health Fund NHF DrugServe.
So this partnership is not asking people to leave the health center where they would not pay to go to the private practitioners and pay. This will be a cost that will be borne by the government, and the patients will have access, despite the prescriptions being written by these private providers, to our DrugServe window through the NHF, or administered by the NHF. So they will neither pay to see the doctor or will they pay to access their drugs.
And persons will still be able to access diagnostic or monitoring tests free of cost. For the news on PBCJ, I'm Simone Absalom.